I'm Dr. Ramesh Gudapati, cardiologist at Star Hospitals. Today I'll be speaking about hypertension, its causes, the treatment, and its effect on the heart. First of all, what do we mean by hypertension? Hypertension also means basically high blood pressure. So normal blood pressure in an individual is usually around 120 by 80. When we say 120 by 80, the upper pressure is what is called as a systolic pressure. The lower pressure is called the diastolic pressure. Systolic pressure means the pressure in the blood vessel when the heart is pumping. The diastolic pressure means the pressure in the blood vessels when the heart is relaxing. That's called the systolic and the diastolic pressures. And the normal blood pressure is usually around 120 by 80. That's the ideal blood pressure. But if some individual has a blood pressure which is persistently more than 130 by 80, then we take it as a higher blood pressure. Earlier, the cutoff used to be 140 by 90, but recently there is a revision of guidelines to say that in adult individuals, the ideal blood pressure is below 130 by 80, and anything above 130 by 80 is taken as hypertension. So, what are the causes for this kind of hypertension? In majority of the individuals, it is primary. Primary means without any specific cause. So, it can be familial, or there is no identifiable cause for this blood pressure in these individuals. So that's called the primary hypertension. But in about 10% of the individuals, we may have secondary hypertension. Secondary hypertension means high blood pressure due to a specific cause, like patients who have a kidney disease, or patients who have thyroid problem, patients who have other endocrinological related problems like pheochromocytoma, or people who have a vascular problem like a coarctation of aorta, or other form of autoimmune diseases. So these kind of patients can have high blood pressure because of the underlying problem. So that is called secondary hypertension. So when you have an individual who comes with a hypertension with any clinical features to suggest any of these secondary causes, or we have a blood pressure which is not controlled with regular medication, or blood pressure coming up at an extreme age, that means very small age. These kind of individuals we need to check up and try and rule out if there are any secondary causes. In all the other individuals, it is likely to be primary or essential hypertension where there is no specific cause. No specific cause in the sense like it is mostly related to lifestyle changes without any other medical condition. So that's the most common cause. 90% of the times it's the lifestyle which leads to high blood pressure along with the genetic predisposition. So high blood pressure should be treated. Treatment of high blood pressure includes one, lifestyle modifications. When we say lifestyle modifications, we mean stopping smoking if somebody smokes, exercising regularly to maintain ideal body weight, because obese individuals are more prone to have high blood pressure. Taking healthy diet in the sense like less of salt. Reducing salt will reduce the blood pressure. More of green leafy vegetables, more of fresh fruits. So all these can lower the blood pressure levels. And then regular exercise of at least half an hour every day and at least 5 days in a week will also help in reducing the blood pressure. So these lifestyle measures are as important as medications in the control of high blood pressure. If despite lifestyle measures, if somebody continues to have a high blood pressure, then we should go ahead and treat them with medications. Or in those individuals who have very high blood pressure, then we start off medications in the first, as soon as it is diagnosed. So the medications in some individuals can start with just one medication. In a few individuals, sometimes we may have to use multiple medications. These days, there are very safe medications with very minimal side effects, good to control the blood pressure, and many of them can be taken once a day. So it is important that you start your treatment for high blood pressure based on your doctor's advice. One very important thing is a lot of patients feel that if they have high blood pressure, if they don't have symptoms, they don't need to take medications. That is a problem, because all individuals who have high blood pressure need not have any symptoms. But high blood pressure can damage the blood vessels, and this can lead to heart attacks, paralytic strokes, kidney failure, and other internal bleeds which can be problematic. So it is important that you control your blood pressure to prevent any further complications or problems.